The A1C test is a blood test that can identify prediabetes, diagnose diabetes, and monitor the effectiveness of diabetes treatment over time. The A1C test is based on the idea that when glucose, sugar, in the blood attaches to hemoglobin, the protein in red blood cells that carries oxygen, it forms a glycated hemoglobin molecule. The more glucose that is present in the blood, the more glycated hemoglobin is produced. Therefore, the A1C test provides an estimate of the average blood glucose level over the preceding 3 months, giving a more comprehensive picture of an individual's blood glucose control, with higher levels indicating a greater risk of diabetes complications. The A1C test should be done at least twice a year if treatment goals are being met, and more frequently if goals are not being met or if treatments change. A1C target levels vary by person and are typically less than 7% for adults with diabetes. The test results are reported as a percentage, with levels between 5.7% and less than 6.5% indicating prediabetes, and levels of 6.5% or higher indicating diabetes. A1C is also strongly correlated with estimated average glucose, EAG, which is similar to monitoring fingerstick blood sugar levels at home. It is important to note that A1C results may not always be accurate. A falsely low A1C refers to a situation where the A1C test result is lower than expected, based on the individual's blood glucose levels. This can happen in certain medical conditions or circumstances where the lifespan of red blood cells is shortened, leading to an artificially low A1C result. For example, people with hemolytic anemia, a condition where red blood cells are destroyed at a faster rate than usual, may have lower A1C levels despite having high blood sugar levels. Similarly, people with sickle cell disease or thalassemia and patients treated for iron deficiency or advanced chronic kidney disease may have lower A1C levels than expected even with high blood sugar levels. A falsely high A1C refers to a situation where the A1C test result is higher than expected, based on the individual's blood glucose levels. This can happen in people with certain medical conditions where the lifespan of red blood cells is prolonged, leading to an artificially high A1C result. For example, people with vitamin B12 or folate deficiency may have higher A1C levels than expected, even with normal blood sugar levels. It is important to note that falsely high or low A1C levels can lead to incorrect diagnosis and management of diabetes. Therefore, it is essential to interpret A1C results in the context of the individual's medical history, other laboratory tests, and clinical presentation. If there is a discrepancy between the A1C result and the individual's blood glucose levels, further testing may be needed to determine the cause of the discrepancy and ensure appropriate diagnosis and treatment. Thanks for watching. If you enjoyed this video, please give it a thumbs up and subscribe to our channel for more great content. Don't forget to click the notification bell so you never miss an upload.